respiratoire pour confirmer le diagnostic et préciser la prise en charge. Autre chose, c'est qu'il y a déjà les équipes au niveau du Centre des opérations d'urgence de santé publique, le COUSP, au niveau de l'INSP, qui est en mode alerte maximale. Et nous avons déjà positionné des équipes du niveau central qui vont quitter d'ici 24 heures pour rejoindre la zone de santé de Panzi pour aller apporter du support à l'équipe provinciale et à l'équipe de la zone de santé pour laquelle nous savons déjà que les capacités de réponse et même des investigations sont assez limitées et nous devons leur apporter ce support assez rapidement. Donc, il y a cette équipe du niveau central qui est vraiment en train de se déployer pour aller apporter ce support au niveau de la zone de santé de la province. Donc, voilà un peu les résumés des informations que j'aimerais donner. Donc, nous sommes vraiment en alerte maximale et nous allons devoir confirmer, avoir le diagnostic, bien que les diagnostics, les suspicions autour d'une infection respiratoire. Mais il faut noter aussi que dans la zone de santé de Panzi, il y a 2 ans, ils ont connu une grande épidémie de fièvre typhoïde dans cette zone et que le taux de malnutrition dans cette zone de santé, il est autour de 40%. Donc, ce sont des facteurs de vulnérabilité que connaît cette zone de santé. Donc,
that this area is witnessing, therefore, the table that most of the patients are presenting now enables us to see that this is a very vulnerable area, an area which is also undergoing a chronic malnutrition, and we want to believe that these people are already very fragile, and besides that, this period is a period whereby we're also having a seasonal flu outbreak, be it in Kinshasa or Panzi. So we are witnessing a seasonal flu outbreak from October to December. So this context should also be taken into account with regard to the advent of this outbreak that we are witnessing in the Panzi health area. So in summary and in short, this is the way the situation is being seen presently. The teams that are on the spot will be supported, and once we're going to receive the results of the diagnosis, we're going to strengthen care and also orientate or guide our intervention. Given that we're not having a specific diagnosis, we don't know whether we are faced with a viral or a bacterial disease, but we believe that under 24 to 48 hours, the results of the laboratories will help us to have a guideline. Thank you. Over. Over to you. Thank you, and sorry for the short break.
To the DG for the briefing. I have to say, at personal level, 20 years ago, I was leading a health zone close to Panzi. I know this region. I know the challenges they are facing. And I think we are here to support DRC and to understand what is going on. Is it a new disease unknown, or it's something that we know, but we want to know what is it exactly? I think this is what the DG said. Ongoing testing will help us to understand what is the issue. Then back to you for questions from journalists.
Thank you, DG. Let's take the first 2 questions from the chat room. The first question asks about the strides that are being made in the clinical trials to enhance new vaccine development for the prevention of Mpox. That's the first question. The second question is about the unknown disease in DRC, which I think has already been addressed. Let's take this one, which asks how many deaths in regards to the unknown illness, and what is the cause that has come to light so far? So those are the first 2 questions. I'll hand it over to you, DG, for the first one, and then the director can take the next one. Over to you, DG.
Thank you so much. I think We had some network issue, but I got the first question. It was regarding the clinical trials. Where are we with the clinical trials and for the Mpox vaccine? Then you'll help me to repeat the second one. Regarding the clinical trials, you know, we have 47 studies ongoing currently regarding Mpox. And our director of science and innovation is working with WHO, with CEPI, and all other partners to see how quickly we can confirm. One of the studies is how to use the Bavaria Nordic vaccine for less than 12, because as you know, we have the recommendation from SAGE, the WHO SAGE, to use that for 12 plus. It means 12 to 17, 17 plus. But now there is this ongoing study for less than 12. We know we have also some other clinical trials for a BioNTech vaccine and other vaccines that are coming. For now, we are moving, but we are not there. I hope very soon we'll get an answer. Regarding the second question, can you please repeat, because we had a network issue?
Yes, DG. So the questions asks about the mystery illness and how many deaths have been recorded so far, and what exactly is the cause that is in terms of the development that is happening at the moment.
Okay, for that, I think the director said, based on the report that they have, 71 cases, deaths out of 382 cases. And I think what is going on, we just have the symptomatology of these cases, but we really don't know what is the cause of that. And for now, based on the guidance from DRC, we cannot speculate on what is the cause of this disease X. But I think the director can come back to give more information when we will have, you know, the outcome from the lab. Over to you.
Thank you, DG. Let's check the next two questions from the floor. Helen from Stats, you have the floor.
Thank you very much. There was a problem with the translation at a point, and so I'm afraid I missed quite a bit of what the Director General from DRC said, and I apologize if I'm asking a question I should already know the answer to. Is it possible that this is not a single outbreak? There was a reference to the fact that there's seasonal flu in that area, and many of the affected people are quite young. It wouldn't be surprising to see a high attack rate for seasonal flu in young children. And there was also mention earlier of a large measles outbreak in parts of DRC, although I think a different part of DRC. I mean, is it possible that what is being reported here is a mixture of conditions, not a single condition? Thank you.
Thank you. Over to you, DG. The director.
Oui, je pense que je l'ai effectivement, on a constaté que
we have actually realized that this sickness, most of those that are affected are very young children, less than 5 years old, that are mostly affected. And as I stated, in that region, they have already been in the past, 2 years ago, a typhoid fever outbreak that was affecting this health area. And then with regard to the symptoms that are being presently witnessed, we believe that this could be the first conclusions are actually leading us to believe that this should be an airborne disease when we look at the symptoms. So this should be an airborne disease. So I said that this is also a period when we're having a surge of cases of seasonal flu. So given that there is an epidemic context in this region, makes us to know that there is also a surge of seasonal flu. Now, with regard to the situation which is underway, we are waiting for the conclusions of the laboratory testing to actually conclude whether this is a type of flu, and this examination is underway, and we hope that between 48 hours we'll be able to have the laboratory results to know if this is a seasonal flu or whether it's a viral or bacterial disease. This will enable us to adapt our response. Thank you. Over. Over, Margaret. I hope you got it.
Back to you,
Yes.
Margaret.
Thank you very much. Let's take the next question. Gabriel Emmanuel from NPR, you have the floor.
Margaret, you can hear us?
Yes, DG, I've handed the floor over to the next question. Gabriel Emmanuel, you have the floor.
Hello?
DG, I can
Hello?
hear you. Can you hear me?
Okay, sorry, it was from my side. Okay, please
From
go
your
ahead.
side, yes. Gabriel Emmanuel from NPR, you have the floor. Gabriel, can you hear us?
Are you able to hear me?
All right,
Yes.
yes, we can hear you.
Oh, wonderful. I'm so sorry. I also missed a lot of the translation. So forgive me if this has already been answered. But did I just hear that we should have answers within about 24 hours for the laboratory results for this unknown disease? And also, I'm wondering if the cases have continued. The press release I saw most recently kind of ended at the with cases ending at the end of November. I wanted to see how things have continued in the most recent week. Thank you.
Thank you. Let's take.
Yeah, please go ahead, Margaret.
Yeah, let's take the next one from Carmen from Politico. You have the floor.
Thank you so much, Margaret. I just wanted to clarify one thing about the testing. So the testing that the DG is talking about, is this the first testing of these cases, or have there already been some tests that already ruled out some potential diseases that we know about? Thank you.
Thank you. Over to you, DG, for the second one, and then the director can take the other one.
Yes, I think the first one is about the outcome of the testing for the disease X. Yes, as the director said, we are expecting that in the next 24, maximum 48 hours. And this is why we are in DRC. We are sending a team of epidemiologists, lab experts, and IPC, infection prevention control, to fly to Panzi with the government. They will fly tomorrow. Then they will assist from Panzi, but also from Kikwit on the way everything is going. And we want to know very quickly, what is it, this disease? You have to know that today the world is wondering. We are getting so many messages about what is going on in DRC. I think before I fly out of DRC, we'll communicate on that. We'll know what is going on. We want also to reinforce the surveillance. I think, as you saw, this disease started on the 24th of October. It's just the 1st of December that the national level was informed about it. It means we have a delay of almost 5 to 6 weeks. And in 5 to 6 weeks, so many things can happen. This is why we are supporting the country to build strong capacity on surveillance. This is just one outbreak. We have a number of other outbreaks, maybe not notified, and people are dying. I think we are taking it very seriously at our level, and our discussions with the DRC authorities, I think, are going very well, and we'll be able to communicate about it. Regarding the second question on the testing, I don't know if we are talking about the testing of Mpox or we are talking about the testing of disease X. That one I didn't get clearly. Are we talking about Mpox or the disease X?
DG, I think the question was on the disease X.
Okay, on the disease X, you know, we collected samples, as the director said. These samples, because Panzi, that is a health district, doesn't have capacity to test, we took the samples to Kikwit. It means almost 500, more than 500 kilometers from Panzi. And our hope, I say our hope, is first, we got quality samples. Second, when the samples will arrive to, will be tested to Kikwit, the outcome will reflect the true reality of what is going on in this region. For now, we cannot comment more. If we comment more on that, it will be just sharing rumors with people. We are led by science. We'll wait for tomorrow, at least Saturday, to have the outcome, and the minister, the Director General of NPHI, and myself will communicate on that. Over to you.
Thank you, DG. Let's take the next two questions. The first one asks about the market availability for antibody or antigen-based lateral flow rapid diagnostic tests so as to close the gap in case confirmation and spatio-temporal dynamics monitoring. That's the first question. And the second question asks about how far has Africa gone in the investment in manufacturing of vaccines and medical materials and consumables. Over to you, DG.
Where are we with other activities, PCI related to response against Mpox, but also against disease X? We'll talk about it. I think the director is here is not just leading a disease X, it's also leading Mpox in DRC. Then it will give us the response about directeur, où est-ce qu'on en est avec les activités de la communication, les activités.
How far are we, Director, with regard to communication activities concerning infection prevention and control with regard to Mpox or with regard to other outbreaks? Over to you, Director. Yes, thank you for your questions. With regard to communication activities and IPC activities, as you know, in the DRC, the Mpox outbreak is affecting all provinces. All the 26 provinces of our country are affected or by the Mpox outbreak. So this can give you an idea, you know, the size of the country and the challenges that we are facing in the area of communication. We have provinces that are the hotspots that are notifying most of the cases. They are the eastern provinces, Equateur, Sankuru, southern Ubangi, Chwapa, Chupo, and in those provinces, we have deployed some major communication activities and awareness building. We have also actually organized briefing sessions, discussed with religious leaders, youth associations. We've also organized radio and TV programs and also prepared banners So these activities are underway. However, our needs are huge given the size of the country. Covering all the 26 provinces is not easy. That's why there are always challenges in the area of communication. So we need, for instance, to prepare messages that should be translated in the local languages, because as you know, in DRC we have 4 official languages in which we have translated messages. We should go beyond those 4 languages because there are areas where these messages must be translated in the local languages that are spoken in the area. In Sankuru, for instance, we need to prepare messages in the Tetela language. This is to be specific, and these messages should be actually addressed to this population. So these are the challenges that we're facing in the area of communication. We should continue to communicate and also to maintain and strengthen these messages in some areas, and in some areas these messages must also be translated in local languages to make sure that communication is maximal in those areas. These are the challenges with regard to communication. Now, with regard to IPC, given that we have IPC at the level of health centers, we should make sure that in all health centers, material for IPC be set up, be it in terms of individual protection equipment, but given the size of the country, we have many needs, and these equipments, individual protection equipment, should also be provided to those health centers that are receiving Mpox cases, not only in the areas where cases are supported, because we have realized that if all the cases cannot be managed by health center, we should also prepare those personal protection equipment at the community level to prevent the spread of the infection at the community level. Therefore, put on IPC mechanisms at the communities also. Thank you. Over.
For the second question about how far are we with the local manufacturing of diagnostics, vaccines, and therapeutics, I think we are communicating on that. We are working to make sure that Africa can manufacture all of these medical countermeasures. For the Mpox diagnostics, I think we also, the statement made by Africa CDC regarding this diagnostic coming, the qPCR test kit coming from Morocco. Regarding the vaccine, as you know, we are working for the tech transfer, and there is an ongoing process. It takes some time, but we are moving. In terms of medicines, as I said, we have 47 studies, ongoing studies. Some of them are related to some therapeutics, because tecovirimat was not found useful for the clade 1b that is affecting DRC and a number of other countries. Once we have some progress, we'll communicate and we'll sensitize our communities to understand that something is moving. Back to you.
Thank you, DG. There's another question in regards to the disease X. The question asks, on what basis have the cases been counted? Can you give some information on the case definition that has been used so far? That's the first one. And the next one is on Mpox, and the question is about the numerous overlapping epidemics. Has it been envisioned to deploy antigen or antibody-based testing of Mpox suspect cases so as to use PCR only for confirmation? I can repeat that question. So given the numerous overlapping epidemics, has it been envisioned to deploy antigen or antibody-based testing of Mpox suspect cases so as to use PCR only for confirmation? Over to you, DG.
Okay, I will respond to the second question while the director will respond to the first question related to case definition of X. And I see Dr. Yenyu, who's more expert on diagnostic. Dr. Yenyu, can you please help to respond to the second question because you are connected, and the Director General will speak about the case definition. Over to you, Dr. Yenyu.
Yeah, thank you. Thank you, DG. Thanks for that question. Unfortunately, either antibody or antigen test has not been standardized for Mpox testing in terms of sensitivity, specificity, and so on. So if you see both the Africa CDC and the WHO guideline, which we jointly published, it does not recommend antibody testing for case identification. It can be used really, to measure the level of exposure because it tells you, past infection. And then for antigen testing, we have been working very, very hard, for evaluation of antigen tests if we can get some sensitive antigen tests. But so far, we don't have really, very good antigen tests with good sensitivity and specificity. So far, what we have is, with sensitivity of 30%, which is very, very low. So that's why, if we see our list of recommended PCR tests, so it doesn't include antigen testing because we didn't have really, quality antigen tests. And the search is continuing. There are some companies still developing, and we will help them to evaluate. If you find a sensitive test, so we'll introduce into the program. But so far, there is no any recommended antigen testing. Thank you.
Thank you, Dr. Yenyu, and thank you, Margaret. Before giving the floor to the Director General, I saw also a question regarding why do these numbers differ. I think we already said we have a major problem in terms of surveillance. And the director will talk about the case definition because that one is leading for some confusion that we have. We are saying things openly based on the information we are getting. And we are so glad that DRC is also applying the transparency. 71, 79, or more than that, we are working with our epidemiologists to see what is exactly, based on the case definition, what is exactly the magnitude of this phenomena. And we'll communicate on that. Director, for the case definition, over to you.
Oui, en rapport avec la définition de cas, effectivement,
yes, with regard to the case definition, our teams that are on the ground, we should note that these are teams that are working at the provincial level. So they are working to check the symptoms. What are the most frequent signs that have been presented by most of the cases? And we have noted that for most of the cases, the most frequent signs, symptoms that were noted are fever, headache, cough, and sometimes difficulties to breathe. So it's on the ground of these symptoms that cases are defined. It's on the ground of this definition that the cases were identified, because we were told that it's since the 24th of October that this outbreak has been observed at the level of this health area. So we needed to have this definition, but this definition will be improved upon thanks to the additional investigations that are being undertaken, and with the arrival of the team from the central level that will also work to actually improve on this case definition. But already we have a preliminary case definition that the teams are using in order to identify the cases. Thank you. Over.
Thank you, Director. I think Margaret and the colleagues, for us, we take it seriously. We are following what is really happening. Is it an infectious disease? Is it a non-infectious disease? If we talk about infectious disease, is this a viral infection? Is it a bacterial infection? Is it a fungal infection? Is it a parasitic infection? You know, all of these symptoms are linked to what I'm saying now. Then we don't know. Even we don't know what is the mode of transmission. There are so many things we don't know. And we are there to know, to understand what is going on. Because if we don't know, not only DRC, but all Africa want to understand if we can stop this disease now. I think this is what is our major priority. As it was the major priority for Marburg in Rwanda, it's a major priority now for us to understand what is going on in DRC and how we can stop that. I think the director gave a case definition based on the symptoms that we have currently. As I said, the symptoms can lead for 20 other diseases, but we are focused to understand based on the outcome of the lab what is going on. Over to you, Margaret.
Thank you, DG. Let's take the next two questions. The first one is about Mpox, and it asks, what are the challenges in preventing a resurgence of Mpox for DRC and Rwanda? That's the first one. And then the second one is about the administration of the LC16 vaccine. The question is, why is it too difficult, both before and after the vaccination? DG, over to you. You can take those two.
Yes, I will respond. I'm glad that I've Chanel also here, Chanel leading this component of operations, but I have also colleagues who are from the vaccination pillar. I think Dude will respond to the second one. Regarding the challenges, if I get you regarding the research that are ongoing, there are a number of challenges. As you know, we don't like to talk about the obvious one. People, they will say funding, but funding is not the only one, because you know there are some requirements for us to conduct a research project. And we have our team working mostly on to understand, you know, as we did for Marburg, conducted the research to understand that this Marburg came from the bat. Now for Mpox, we want to understand also what is going on. Why would we have the 4 outbreaks? How can we ensure that we will not have the 5th one coming? What is the tools that we can have that can be available for any kind of Mpox outbreak? I think this is what is ongoing. It's so complex, but we are moving. Dude and colleagues who are leading the vaccination pillar, can you please respond to the LC16 vaccine question related to that?
Yes, thank you, DG. Thank you for the question. In terms of the L16 vaccine, the DRC has entered into discussions with the Japanese government in terms of the procurement of 3 million doses. And we are in discussion at this time in terms of the training materials to ensure that this new vaccine is well accepted at the country level. So we are working closely with our CCE colleagues to ensure that we have the necessary documents, the necessary training materials, and also that the messaging is appropriate in terms of our communities. So this work is ongoing. We are discussing again with the Japanese government on how to operationalize this situation. We are confident that we'll be moving forward towards a decision to have the vaccine in the DRC in the next few weeks. But again, the question in terms of the the challenges related to the vaccination for this vaccine. We are making sure that the messaging is out. We're making sure that we have the right tools, that we understand the utilization of this vaccine, so that once it's ready here, that the community can accept the vaccine appropriately, and that the uptake is what we expect. Thank you so much, Margaret. Over to you.
Thank you very much. Let's take the last two questions. I have Kiriza online. Kiriza, you have the floor.
Chanel, before that, Margaret, before that, Chanel want to provide, to complement what Dude said. Chanel, over to you.
Great, thank you, DG. Thank you, Margaret, and thank you, Dude. Maybe just to complement a response to, I think, one of the specific parts of the question, which was regarding the administration of the vaccine. So the vaccine requires to be administered with a bifurcated needle, which needs to be sterilized. It's not a administration mode that is commonly used anymore, so that requires the training which Dude referred to. And then after administration, the location of where the vaccine was administered needs to be covered and maintained with good hygiene. And so that is also an important part of it. So both the administration and after administration, as the question implied, are really important parts of the vaccine being effective and also safe. So those are going to be important parts of the training if the vaccine is used. Over.
Yeah, Margaret, over to you.
Yes, thank you very much. Let's take the next question from Kiriza. You have the floor.
Margaret,
Kiriza, can you hear us?
Yes, please go ahead.
Kiriza, you have the floor. All right, let's take the next one. Zandile, you have the floor. Zandile, can you hear us? There's a delay. Zandile, you have the floor. Can you hear us?
Margaret, I think Kiriza wrote his or her question because I don't know if.
Right.
Yeah, Zandile, please go ahead, please.
Good afternoon, colleagues. It must have been an error from my side. Sorry.
Yes. We can hear you.
Zandile, you are muted.
Good afternoon. Can you hear me now?
Yes, we can hear you.
I was saying it must have been an error from my side, and I apologize.
Right. Okay. I think, we have the question from Kiriza on the chat box?
Yeah.
If you can see. Yes.
Okay, I think it's mostly for the director. I will hand over to the director. Director, the question is in French. Kiriza dit il y a un gros problème.
She's saying that there's a major issue with regard to the provision of care. In Goma and Bukavu, no measure is taken. How did vaccination precede awareness building in Northern Kivu? And why is it that laboratory results are delaying? I think that this has to do with the X outbreak. Director, over to you. Director has the floor. Yes, with regard to the first question that was asked by Kiriza, problems concerning the provision of care at the level of Goma in northern and also in northern and southern Kivu. I don't know what he is really referring to, which kind of problem he's referring to, because be it in Goma or Bukavu, we have Mpox treatment centers that have been established At the level of Goma, we have 3 Mpox treatment centers. There is even one that was initially used during the Ebola outbreak. That's been taken over now to handle Mpox cases. So the mechanisms to provide care mechanisms have been put in place. So I don't know what this colleague is referring to. We know that we have faced some difficulties, some challenges to provide care for cases that have complications, because we have some Mpox cases that have some eye complications or that have developed respiratory complications. These are the problems that we have had to manage, because in some Mpox treatment centers, they are not actually equipped to manage such complications, such as respiratory problems, difficulties, or eye difficulties. These are problems that we try to cover to make sure that we put in place mechanisms to actually cover such complications. We have identified areas, centers where complicated Mpox cases that require a very specialized management should be referred to. So if he is referring to this type of complications, I think that we have now set up some centers where we can refer such cases. Now, with regard to vaccination, why did we not start with awareness building? What we should bear in mind is that vaccination against Mpox is different from the other vaccinations or immunization campaigns, routine immunization campaign. This is not a mass immunization campaign, because we should bear in mind the fact that this Mpox immunization campaign is targeted. We're not actually vaccinating everybody the way we do with other diseases. So this is a targeted vaccination, and it is an interpersonal communication. We go and meet the target group that we want to vaccinate. They are the ones that we are sensitizing. So this is not a mass awareness building campaign. It does require an awareness building campaign, because the strategy is not a mass immunization campaign. We should be very careful. That's why we don't want to organize a mass communication, whereas we are not having enough vaccines, and vaccines that are not actually targeted to the entire population. That's why the awareness building messages must be targeted to make sure that those who are entitled to vaccination should receive it. Thank you. Over.
Margaret, I think the director provided an appropriate answer for that. Over to you for other questions.
Yes, with that, DG, we have come to the end of the weekly briefing this week. We'll now hand it over to you for your closing remarks.
Thank you so much. I think today we discussed these 2 topics. While we are saying for Marburg, let me start by making it. I got very good news from the US saying that from yesterday, people flying from Rwanda, they will not be channeled to 3 airports as it was the case when we had the level 3 status. I think for now we can consider that all measures are lifted. The level 3 that was downgraded to level 2, and also this measure to channel people only in 3 airports, even if you are going to another state. The second, and we are still waiting for Marburg on, I think next week will be the week of 11 December. We'll be celebrating officially end of Marburg in Rwanda, because it will be 42 days after a confirmed case of Marburg, the last confirmed case in Rwanda. Next week, we hope during our press conference on the 12th, we'll celebrate the success in Africa. Regarding Mpox, we saw that we still have challenges in terms of cases. We still have challenges in terms of surveillance and testing capacity. What we are saying for Mpox is also what's happening for the disease X. We are saying we need in Africa to have strong surveillance system. And this is our business. This is what Africa CDC must do. Our job to support countries to reinforce, to strengthen the capacity for appropriate surveillance system and lab. How can we accept to have 5-6 weeks of delay? It's just because the surveillance system is weak. You can also see for the lab, we are still waiting to know what is going on. This is why we say we are calling our partners who pledged resources to support the Mpox outbreak response, to provide this funding for us and countries to build capacities. We don't want to see again another disease that will take 4, 5, 6 weeks before official notification. Regarding this disease X, we say we are waiting for the outcome from the lab, either tomorrow or on Saturday, to know what is going on. If there is any additional support we need to provide to understand the phenomena, we'll do that, but we need to know, to give a name to this disease. That will help us to know how to respond to that outbreak going on in Kwango. With that, thank you so much. We hope first to send you a communication by Saturday, Sunday on Disease X. And second, we hope to see all of you on the 12th of December for our next press conference. Good afternoon, good evening to all of you.